Welcome to the last scheduled hearing of the Select Committee. Following this hearing, we'll begin the work of developing our report, which will include actionable recommendations. We may need to reconvene additional hearings as we work through that process, but hope to complete our report by early spring. Just last September, Senator Bernie Sanders introduced his Medicare for All bill on the Senate floor and said this, quote, "The truth is, embarrassingly, that on this enormously important issue, there has not been the kind of research and study we need," end quote. Just yesterday, the United States of Care was announced. This new nonpartisan nonprofit headed by Andy Slavitt, who served as the acting administrator for the Centers for Medicare and Medicaid Service in the Obama administration, has convened a high-profile group of public health figures to reshape health care. It's one of the many different groups building and mobilizing a movement to achieve long-lasting solutions to ensure that every American has access to high-quality, affordable health care, regardless of health status, social need, or income. Amazon rattled the healthcare market a couple of weeks ago when it announced a partnership with Berkshire Hathaway, JP Morgan Chase, to create a nonprofit healthcare company focusing on cost reduction, increased transparency, and user satisfaction. Although no details have been revealed, it will be a force to be reckoned with. Here in our state, many organizations have been advocating for changes to the healthcare system. Healthy California, a very passionate group of advocates, along with CNA, California Nurses Association, has raised the awareness and certainly the decibels of this issue on behalf of all Californians, and we absolutely need to thank them for that. The answer should not be in politics, but in bringing together everyone with one goal. I can assure you that my goal has always been to find a constructive, affordable, and lasting approach. As I've said many times, I make no apologies for the amount of time we have spent on this complex issue. We spent more than 10 times the hours usually afforded a typical bill in a regular Assembly Health Committee hearing. 28 and a half hours and counting today. Our work has been comprehensive and thorough. We must ensure that any significant changes to our healthcare system works for all Californians. It must be affordable, it must be quality, and it must be sustainable. No mistakes, no empty promises. On Monday, we learned about the many challenges we face in implementing significant changes to our system. And although they are not insurmountable, they will take time. And more than that, will take a change in the balance and power in Congress to get the changes in federal law that we need. Today's hearing will provide the opportunity for a number of organizations to present their plans for achieving universal health coverage, including the California Nurses Association, the California Physicians Alliance, Health Access California, the California Immigrant Policy Center, the California Labor Federation, and Small Business Majority. I want to thank all the committee members for their active participation over the past several months as we close in on a pathway to a healthcare solution for everyone who calls California home.